Okay, so we have some experts here in XR and medicine and wellness. I'm in the wellness area, but we just heard Walter's speech, and I think it would just be really cool to have questions from the audience. Yes, we have a question. Oh, yes. Yes, please introduce yourself.
After you.
I'm Omer Liran. I'm a psychiatrist at Cedars-Sinai Medical Center, and I co-direct the virtual medicine lab. I'm a full-stack developer and develop and research emerging therapeutics. So, thank you for having me.
Hi, everyone. I'm Mark Zhang. I am the president of the American Medical Extended Reality Association, which is the medical society dedicated to medical extended reality. And I'm excited to be a part of this. So thank you all.
Thank you. We would just love to get questions from the audience. I saw that Jerry raised his hand.
Hi, I'm Jerry Craig, and I'm a psychiatrist at the University of Toronto, and my interest is in data ethics, and I also have a law degree. So I'm in Canada. I'm on the Association of Medical Defense Organizations with 115,000 doctors. So one of the issues that comes up is the issue that was mentioned this morning about guardrails. And you mentioned the issues of data ethics and the issues around how to protect patients, because I think everyone here, I would say, has noble intentions, but the road to hell is paved with noble intentions. And we've seen people get killed in the use of this. And my concern is the lack of regulation. And every other organization, every other human endeavor is regulated. So you buy a car, but you don't get to drive it without a license. And so the issue here that I have seen, and there's a book coming out at the end of December, which co-author on, is the issue there's pace and profit, but people and protection are less important in the industry. It's often the pace and the protection is not in the same level. So I sort of feel that we need to be focusing on all of those. Mercedes doesn't get to put the car off the lot and say, well, it's not our fault that it didn't work a month later. So that's my comment, and I'd like to hear.
Just very briefly before I pass the baton, I think it's a design issue. I think if we design the right way, we can have the balance between collecting this very important data that can empower psychiatry and other aspects of mental health care, but also look out for privacy. I don't think we can get it from the regulators. They won't move fast enough. It's a complex area. I think we have to do it.
I completely agree with your comments. We always try to be very mindful of that. Everything we do, we validate through rigorous research. We don't just unleash it on the public. And no offense to computer scientists in the dorm room, but if you don't have actual patient experience, you better talk to someone who does. Don't try to make a mental health app without that experience. So everything you said, I agree with. Whether it's going to be regulated by the government or by industry, that I don't know. I think it's going to be very hard to get the government to regulate this technology. There's so much money in it for so many different companies with very bad consequences often. But that's why Cedars-Sinai we're trying to do, what we call medical grade AI, where we're really, really rigorously validating the technology and putting a lot of guardrails. I gave a lecture earlier today where I spoke about all the guardrails we put, but at many different layers, we make sure that the system performs as intended.
Yeah, it's not controversial what you're saying. I think you're making a very valid point. And frankly, that's the reason why we think it's very necessary to have a medical society to help create some of these places for people to actually have these conversations. And actually, one of the very first initiatives we did as the Medical Society for XR in America is create, in partnership with our publisher partner, Marianne Lieber, the Journal of Medical Extended Reality. And that's the first peer-reviewed open access journal dedicated to this field. We want to build it as the journal of record for XR, and explicitly one of the first things we did was use that as a platform for guidelines and commentary. So we've actually released our very first guideline around terminology and medical extended, like this is the state of XR, is we thought it would be very valuable, and it has been, to just create some foundational definitions and terminologies in the field. So we're all talking about the same thing. One of the things that JMedXR has done, and I think it's incredible, is actually partner. It is the official journal of the American Medical Extended Reality Association, but also it's international. So it's partnered with medical societies in South Korea, the Medical Metaverse Society. Importantly, one of the partner groups is XRSI, which is the group focused around safety. And they have a subsection specifically around kind of healthcare. I would highly encourage you to consider thinking about publishing a commentary or joining the initiative and helping with those guidelines, because I think that's incredibly important. The last thing I'll say, it's going to take, there's always a chicken and egg about this, right? And I know, and I'm just explicitly, I'm not wearing any federal hat. I have a federal hat. I'm not here in that capacity. This is something that's very interesting, and people are very invested on the federal side to think about safety. And I think there are groups actively looking at this. It's going to take all of us working together to come up with a pathway. So, come help us. Look at that. Look at all these questions. Holy heck.
Good afternoon, and thank you very much. I am a nationally certified medical interpreter. I use VRI technology. I've been doing it for 20 years, working with a local community hospital in conjunction with Harvard Medical School and Beth Israel Hospital. One of the things that we're testing now are these AI apps, and we're trying to figure out how we as a team can complement our nuances and the things that we do with a human touch, complemented and enhanced by AI versus being in a panic about being replaced by AI. I'm also concerned with Jared's commentary about HIPAA and how we can secure and create those guardrails to make sure that the neurodynamic or the neurodevelopmental units are able to use XR technology to heal versus some other outcome. And I'd be very interested to hear how you see the human interpretation field or language access. Let's just start there. Language access, and that can be nonverbal. And I saw a lot of really great stuff today. I'd really be interested in your thoughts about that.
Wow.
Yeah, I'll start. So, these are definitely valid concerns. It's impossible to know what the future holds. As of today, technology to replace people like you does not exist. I don't know if that technology will or will not exist in the future, but I do know that humans will always prefer humans over machines. We see that when we go watch humans playing chess. We don't watch computers playing chess, even though computers have super intelligence when it comes to chess. I think even when they have super intelligence with mental health, many, maybe most, will still prefer humans. The AI, the way I see it, is that it augments. We have a mental health crisis, not just in this country, but in many countries around the world, maybe most countries around the world. And that crisis is growing. The demand far outstrips the supply, and we're not training mental health professionals nearly fast enough. So in my mind, the gap has to be technological, unless we're miraculously going to train more people, but that's unlikely to happen. That technology needs to augment the humans, not replace the humans. And those are the types of technologies that we're trying to develop.
Like a training?
Like a training tool, also a monitoring tool. So when patients are at home, the therapist can have information about what they're doing. It can reinforce what they learned in therapy. So, how many patients do we have that I think they would benefit from seeing me twice a week, but I can only see them once a month? There's a gap in not just for people who absolutely can get mental health if they wanted to, help if they wanted to, but also they just don't get enough mental health support. So this is a gap. You can direct the AI about what you went through in therapy, and that can reinforce the lessons in everyday life. But again, augmenting and supplementing what a therapist is doing.
Did you want to? Maybe I'll just say one thing. I think safety is, of course, very important. I'm an informaticist by training, so that's my background. And we have this saying. It's I think it's Friedman's fundamental theory of biomedical informatics, right? And the concept is a very simple algorithm, which is computer plus clinician is greater than clinician alone. And there's some updated version of it with the new kind of world. And I think Walter kind of said this, right? He invoked the Gibson, right? The future is already here. It's not evenly distributed. So the current reality is when that theorem really landed, that was in the 80s when they were talking about straight up computers, right? Like a desktop computer or maybe a mainframe, frankly. Now the concept of a personal computer is so different. We have these crazy, supercomputers in our pockets, right? We have, new technologies that are heads-up displays that are just fitted into our glasses, XR and VR and wearables. I mean, we're living in a new future. And this updated theorem is going to have to involve that new calculus. And I think the update is that future where the clinician plus, emerging technologies like XR and AI plus computers is greater than clinician and computer alone. So as we kind of move towards this, I've heard from both questions this theme of a concern of safety and HIPAA compliance. As an informatician and also someone who's applied these things, both in my academic field, but also as a researcher, that is just base hygiene. You don't do these things unless you have that. So to me, that's case by case and base hygiene. It has to be answered before you deploy it at scale.
We activate what's active, deploy it. Then there's a whole
Absolutely
separate set of layers that really need that nuance. That I'm not altogether sure we're there yet, but I see that supplemental way, which the interpreter plus AI, or virtual reality would be stronger than just.
I think there's a pathway. My take and maybe just to close us out is, it's all about. I'm not sure there's a blanket kind of answer. I think it's very specific to the use case, but certainly when we talk about a hierarchy of needs, safety and security has to be at number one, whether it's privacy or just does the intervention actually work? And, I think a general philosophy to live life by, but certainly in healthcare is, mostly helpful, hopefully not very harmful, only occasionally harmful, but mostly helpful, right? That should be the general philosophy. That's true. That is true. Yeah.
Who's got a burning question? Okay.
Yes, I guess two questions directed at two people. For Walter, you alluded to evidence that's come out showing that some of these AR, XR technologies are better at, let's say, behavioral adherence that improve patients' health behaviors, right? Could you talk a little bit more about that? Because I'm really curious about it. And then, Tristan, I have a question about these wellness apps. Specifically, what is your moat in terms of what makes your company defensible? Because what I've seen is a bunch of highly produced videos that are currently already free on YouTube, and increasingly maybe AI is going to produce it. So how do you protect and build the company and scale it and fight off competitors?
Ooh, that's a good one. We want to start with Walter. Let me think about that for a sec.
So if I understand your question, it's what are we seeing in the field of behavioral medicine?
There's a company called Stave, for example, that like fell as to me, but maybe they like don't drink whatever creators you say you drink today. It does have like a work company that I don't like.
Right.
It's like a way to like reinforce up here for some company. Like, do you see something like that, like HarvardXR or whatever else?
Absolutely. I think what we now have is a platforms that can be used to understand an individual, what motivates them. As we know from our colleagues in the gaming arena, some people are motivated by competition. Other people are motivated by collaboration and working with others as a team. Other people are motivated by knowledge and learning. Many of us are motivated by a mixture of those things. But once we understand what is useful to an individual, what motivates them, and maybe it changes through the course of the day or the course of the month, but we now can use sensor technology to better understand the user, what they're focusing on, what is helping them adjust their behavior. And it might be, the strategy that you described of economic punishment if you don't do what you're supposed to do, or it might be something where there's a reward system involved, or it might be an intermittent reward, which is the most rewarding thing for mammals, is to have every now and then something amazing. That's why gambling works. But the point is, we now have a way of measuring, understanding, and using that to come up with better interventions that match an individual. So I think we're at an amazing time to empower the field of behavioral health in many ways. And you were asking Tristan how she might be able to differentiate her work from others. Well, I think the sooner you start incorporating some biosensing and dynamic and protect it there and get some data sets for that.
Yes.
But to the other questions, do it protecting people too.
Absolutely. So we are right now part of a study in the UK with 4 prisons, and the early results that are coming back are so striking. And this is part of the data. It's not published yet, but when I read that data, it gave me this feeling like I know what we're doing really benefits people. Now, yes, other people can do something similar. I've been in the trenches for 9 years, so I have a lot of learnings along the way. We have a lot of tools we've developed. So behind the videos, there's a framework, there's a system, there's a method. And also, there's a certain amount of experience that we have working with companies, with people. And there's that, and there's also there's a timing. We've been working on this. If Anaya and Sarah Hill were here talking, it's not easy to scale a meditation VR company. Believe me, it's not easy, but it's worth it. It's worth it because, I think in the future all these things will be very commonly ubiquitous. But I guess my moat is that every single meditation immersive company that's out there will have its unique flavors, its unique personalities, its unique voices, its unique, each one is unique. So we should all thrive together. I welcome people to join the ecosystem.
I think that's a very key point, Tristan, is I don't think there's any competition in this zone right now. What we have to do is wake up the establishment about the power of this technology, what it can do. I think it's like when the gaming industry first got started, people realized if they viewed their game as competing with another game, they weren't going to get the consoles they needed and the awareness. And now it's a multi-billion-dollar industry because people realize they need to cooperate as well as compete. And I think one of the reasons Silicon Valley thrived is cross-licensing, working together, competing, but also collaborating. So I think you have the right attitude about that. Did you guys want to add to that?
Just to reflect, I don't have any equity in this, but I do think that the current state of kind of XR is still, in my opinion, still pretty early. It's burgeoning, especially in the medical and healthcare field and the allied. And really, it's not a competition in my estimation about Coke versus Pepsi. It's about soda at this point, right? So the more we can move towards soda and thinking about that, that's the current hill to climb.
The only one thing I will add is people have different preferences. What I found through my research is that nobody likes the same, not everyone will like the same product. Some people prefer CGI, some people will prefer nature 360 videos, others will prefer other stuff. The best approach is to give people options.
Yes. How we accept this?
Yes, variety is the spice of life. And you had a burning question.
So, Tristan and for Walter, I love that you're doing 360 videos. I think they're amazing. I'm a photographer, so I love the videos, and Iceland's amazing. My question is to both of you, because I know, Walter, I think you've done work in this area, which is the biofeedback aspect of, recording the brainwave activity and then playing back the sounds that actually elicit those responses that you're trying to get in your app. And have you played with that yet? And I would love to hear, Walter, any feedback you have in that world.
I think Walter has more experience in that because we haven't started to work with that part.
Well, I think the more we can leverage biosignals as part of what we're doing will both personalize and magnify the impact. But in terms of biosignals, EEG is a complex signal, but we're mastering it now. We're, as was demonstrated earlier, there's technology now that can use even sensors around your ears that can collect the EEG signal. But there's also FNIRS technology emerging at a lower cost. There's the whole neurotech arena is receiving a lot of attention because there are amazing things we can do in behavioral medicine, mental health care, leveraging biosignals. And that's the key part, in my opinion, is I think it's, there's a lot that can be done that's invasive, but I think non-invasively we can help people learn to control their computer without having to open up their head. So there's many things on the horizon that can be incorporated. And again, I think what we should all be excited about is we have platforms now. We can create experiences. And on those experiences, we can measure and we can dynamically change to personalize the clinical event. So biosignals are a key part of that tripod. Okay, well, thank you guys.
I